So we have a patient who is 52 years old who has an episodic epigastric discomfort, gnawing and hunger-like sensation. Basically, he is complaining of the abdominal pain and abdominal discomfort. The important thing about this is that this pain generally occurs after 2 to 3 hours of the lunch, that is after 2 to 3 hours of the food, and it is relieved by eating a snack or taking over-the-counter antacids, and occasionally he is awakened by at the 2 a.m. This is very important find. So whenever you have these three things, that is a pain which occurs 2 to 3 hours after the lunch, or the pain which is relieved by eating a snack or taking over-the-counter antacid, and occasionally patient is awakened in the night, then this is generally a pain of duodenal ulcer. Please remember, in 2/3 patient of the duodenal ulcer, there will be a history that patient will be awakened in the night, and especially between 2 to 3 a.m. because at this time the BAO, that is basal acid output, is maximum. Now, very important point, if you see the current symptom, he is complaining that the pain has become constant and it has become dull and it is radiate towards the back. So it is pointing out towards a very important complication of the duodenal ulcer. But before going to that, we will see some of the negative history. The patient denies that there is no sudden onset of severe generalized pain, because severe generalized pain in duodenal ulcer points towards the perforation. That means this patient is not having perforation. Vomiting of undigested food. Vomiting of undigested food in a case of duodenal ulcer points towards gastric outlet obstruction. So there is no gastric outlet obstruction, and he is denying presence of tarry stool. That means there is no bleeding. So these three complications, perforation, bleeding, and gastric outlet obstruction, are not there. So what is the basic thing in this patient? The pain has now converted to a constant dull pain which is radiating toward the mid back, and it is no longer relieved by food and antacid. So this is one of the complication where duodenal ulcer is being converted into basically it is extending into the pancreas, and this is a very serious complication. Now the ulcer has becoming enlarging, and it is because in the posterior of the duodenum we have pancreas. So this is basically extension of the duodenal ulcer into the pancreas. Now we will understand why we have these kinds of symptoms. Now this is duodenum. So what you see in duodenum, this is food and this is the acid. Till the time there is food, the acid will go and act on the food, or we can say that food act as a sponge and it will absorb the acid. So there will be no pain. So till the time there is food, there is no pain. So pain is inversely proportional to the food. Now in this second scenario, you are seeing that there is